So Paul Saladino recently shared his lab values, and I'm going to go over them. I'm Dr. Allo. I'm a double board certified cardiologist, board certified in internal medicine and cardiovascular medicine, and I'm actually a certified personal trainer, so maybe I'm triple certified. But anyways, what does a cardiologist think of Paul Saladino's lab? So he goes through all of his labs. It's not a very long video. You can go watch it if you want to. But the majority of his labs, from what I could see, obviously I'm an internist too. Cardiologists are internists, so we know about kidneys, we know about liver function, we know about, cortisol, we know about all that stuff. So that part, most of it, thyroid function, etc., was not that exciting. Most of his numbers are within normal limits. The only two numbers that I saw that were a little bit off was his total cholesterol was 222, which we have no targets to treatment for total cholesterol. It's not a value that we care that much about. It is, however, above the cutoff. The cutoff now is 150. So above 150, we consider that high. Most of your cholesterol is in your LDL particles, and his was 151. Now, we know from the PISA trial, the prevention of early subclinical atherosclerosis, which looked at young people, mean age was 42, basically non-smokers, no calcium scores, minimal atherosclerotic risk disease, low BMIs, not overweight, not obese, sort of like Paul would describe himself, metabolically healthy, maybe not as metabolically healthy as him because he's super lean, probably in the 10% body fat range, maybe a little less sometimes. But when you look at it, when you look at that cohort of people, we found that people with a normal LDL, which back then up to 130 was normal, 45% of them already had subclinical atherosclerosis, which means like atherosclerosis that's not yet detectable by normal means. Doesn't show up on your calcium scores, CT angiograms, cardiac catheterizations, any other way. They had to use very, very fancy imaging, very fancy ultrasounds, and they found this plaque. If you go to the next level up, which was an LDL cholesterol, I'm sorry, that was at an LDL of 110. LDL of 110, it was 45% of all people had plaque. When you go to the next level up, which was 130, it was 54% of all people had subclinical plaque. When you went up to 150, which is where Paul is, 151, 68% of all people had subclinical atherosclerosis. So Paul fits into that group. And we know over time, the longer you're exposed to LDL cholesterol, the more years of LDL cholesterol you have, the worse your outcomes, the more plaque you have. Soft plaque is not detectable by any conventional means that we have today, especially arterial, intra-arterial plaque. If you look at this model here, this is what you're supposed to look like. This is where plaque builds up first. It's in the deep layers of your arteries. It does not encroach on the lumen yet. Most of the CT scans, cardiac caths, everything else we do checks blood flow through here to give you an indication of how much plaque you have. But when the plaque is down here inside the walls, you cannot see that in any way in any modern imaging other than something called OCT, optical coherence tomography, which is intravascular optical ways of checking, and or IVUS, which is intravascular ultrasound, which you cannot do on people because it's super invasive. So they've done other ways to do this. Now, the PISA trial also found that of all those people with atherosclerosis, 63% of them had atherosclerosis in more than one arterial bed. So they had it in their carotids, their coronaries, their femorals, what have you, more than one arterial bed, they had atherosclerosis. So I did do an interview with Paul. You're welcome to go watch it. We went over some of these topics. We didn't agree on a lot. He did in the end agree that LDL cholesterol was heavily involved in atherosclerosis. He had some other views on it. But obviously, as a cardiologist now, we know with over 20 million data points, multiple studies. And if you had the Fourier and the Odyssey trials, it's probably way over, 20 million data points now. LDL cholesterol or ApoB lipoproteins are the cause of atherosclerosis. So get those numbers down. We now recommend everyone be under 100. All comers, their LDL cholesterol needs to be under 100. If you have a risk factor, you need to be under 70. If you've already had a cardiovascular event like a heart attack or stroke, you need to be under 55. And if you've had multiple events, you need to be under 40. If you like this kind of stuff, follow me on here and share with others.